What are the signs of bladder cancer recurrence after TURBT? Imagine having a treatment that removes a bladder tumor, only to find out later that the cancer has come back. Understanding the signs of bladder cancer recurrence after transurethral resection is key to catching it early. After TURBT, which is a common procedure to treat non-muscle invasive bladder cancer, the risk of the cancer returning remains quite high. Studies show that up to half of patients may experience recurrence within the first year. That's why knowing what to watch for can make a big difference in outcomes. The most common sign of bladder cancer coming back is blood in the urine. This might be visible as a pink or red tint in your urine or only detectable under a microscope. If you notice blood at any time after your surgery, it's important to contact your healthcare provider right away. Blood in the urine can happen for many reasons, but in someone with a history of bladder cancer, it warrants prompt medical attention. Urinary symptoms are also common indicators. You might feel an increased urge to urinate more often than usual or experience a burning sensation during urination. These symptoms can suggest that the cancer has returned or that there is some irritation or infection, so reporting them to your doctor is essential. Sometimes, patients notice a change in urinary habits or experience discomfort that wasn't there before. Timing is also important when considering recurrence. Early recurrence happens within 6 to 12 months after treatment and tends to be more aggressive. Late recurrence occurs after a year or more, and while it may be less aggressive, it still requires careful monitoring. Doctors often recommend regular checkups and cystoscopy exams every 3 to 6 months during the first few years after treatment. During cystoscopy, a doctor uses a small scope to look inside the bladder for any signs of returning cancer. Recurrence happens because some cancer cells can remain in the bladder even after the tumor is removed. These residual cells can start growing again, leading to a new tumor. Sometimes, new tumors develop in different parts of the bladder, which is technically a new occurrence rather than a true recurrence. The likelihood of residual disease depends on factors like tumor grade and stage. High-grade or multiple tumors are more likely to leave behind residual cells that can cause recurrence. Because of the high chance of recurrence, ongoing surveillance is vital. Regular cystoscopy exams, urine tests, and imaging studies help catch any signs early. Most doctors recommend these follow-ups every 3 months during the first 2 years after treatment. Early detection allows for prompt intervention, which can improve the chances of successful treatment and better outcomes. If you've had TURBT, staying alert to symptoms like blood in your urine, increased urinary frequency, or pain during urination is crucial. Always keep up with your scheduled checkups and communicate any new symptoms to your healthcare team. Remember, each person's situation is unique, so personalized advice from your doctor is the best way to stay on top of your bladder health. Regular monitoring and early action can make a significant difference in managing bladder cancer after TURBT.